Hello everyone, myself Dr. Rachitha Rungta, consultant nuclear medicine physician at Shankara Cancer Hospital, Bangalore. Today we will understand the basics of nuclear medicine, the facilities we have in nuclear medicine and a few important points. So in nuclear medicine we use radiation which is in a very minimal dose. A very minimal dose of radiation is injected into the patient. The radioactive medicine what we use is called a radio tracer. So once the injection is done, we can use it for nuclear medicine diagnostic as well as therapeutic procedures. Nuclear medicine can be divided into subgroups like diagnostic nuclear medicine and therapeutic nuclear medicine. So in diagnostic nuclear medicine, we have PET-CT and gamma camera imaging. PET-CT is a very commonly done procedure in cancer patients. So the most common radiotracer which is used worldwide for PET-CT is FDG, the full form being fluorodeoxyglucose. It is a glucose analog and this FDG is injected into the patient through IV line, that is intravenously. So after this intravenous injection, this radiotracer, that is FDG, it goes into all over the body through blood circulation, and once it reaches cells of the body, every cell which is using glucose will uptake this tracer in their cell. So, but cancer cells being highly metabolically active, they are having increased metabolism. So these tracers specially go and sit inside those cells, which can then be imaged on our scans. In cancer patients, these PET-CT procedures are done at staging, that is, once the patient is diagnosed with cancer, to look after the disease spread, that is, if it is at the local site or it has gone to any other place other than the local site. So if it is metastatic or it is at a certain place, to know that, we usually do it as a staging PET-CT scan. Other than that staging, it can also be used in patients who are undergoing treatment. So once the patient has been started on certain treatment, the patient has to undergo PET-CT as a response assessment scan. Treatment is actually working for the patient or not, that can also be taken care of by PET-CT scans. So at staging, at treatment response, also at if the patient is being suspected with recurrence. So if the patient has been treated earlier and then if there is a chance of recurrence in the patient, if there is any clinical symptom which is suggestive, which is going towards recurrence, PET-CT scan can be done to look out for any recurrent sites. So in patients where the patient is having symptom but we are not able to understand what is the disease, where can the biopsy be done from. So even in these patients, PET-CT help in detecting a site for biopsy. So these are certain indications where PET-CT is done in cancer patients. Now we will look into certain patient preparations which are to be taken care of before a PET-CT is done or is advised. So there are few patient preparations which the patient has to take care of, like the patient has to be in fasting state for around 6 hours. So if the patient is appointed for next day morning, from midnight it is preferable to be in a fasting state. During the fasting state, patient can have plain water, but tea, coffee, coconut water or any juice, these are to be avoided during the fasting state. Only plain water is allowed during the fasting state. Apart from the fasting, patient has to take care of the blood sugar levels. If the fasting blood sugar level should be within 200 for a PET-CT scan to be performed. Now, if the patient is diabetic, patient should not take any anti-diabetic medication, be it oral tablets or an insulin injection before PET-CT scan. So at least 6 hour gap of anti-diabetic medication or insulin should be there between the medication and PET-CT study. Any medications like antihypertensives or any epilepsy drugs or any liver function medications, these can be continued as advised by their physician. So no need to stop these medicines, like even thyroid medicines need not to be stopped in the fasting state. Only anti-diabetic medications has to be stopped before this PET-CT scan. Apart from this, patient should carry a serum creatinine blood test report. So this creatinine blood test report tells about the renal function, which helps us decide if the scan should be a contrast study or a non-contrast study. So based on the serum creatinine level, we or our team will decide about this procedure. Apart from this, also the patient should carry all the previous records, previous CT scans, PET CT scans, CDs, everything the patient should carry with them. It helps us in better evaluating the patient. Once the patient is advised PET CT scan, patient will take an appointment from our department, and after the appointment, patient will be given an instruction list, which I also discussed right now. Patient has to follow all the instructions. On the day of appointment, patient has to come to our department. The first thing we do is check the blood sugar levels, check the vitals, if patient is stable, if the patient's blood sugar levels are within control or not. If it is within control, that is within 200 of mg per deciliter, then we can take the patient for the scan. If it is more than 200, then the patient might be rescheduled and might be told to control blood sugar levels and then take an appointment. So once the blood sugar levels is in control, patient is stable, we take the patient for scan. Once the patient is received in our department, an IV line is put, that is an intravenous line is put, and through the IV line, our tracer, that is FDG, is injected into the veins. Once FDG is injected, patient will feel everything is normal, because patient will not feel it that anything is being injected to the patient, any radiation is given to the patient, patient will not feel anything like that. It is just a normal injection, a very small injection, a very minimal dose is given, because patient safety is our priority. So a very minimal dose of radiation is injected into the patient. Once injection is done, patient has to wait in a certain waiting area. It is specially designed for nuclear medicine procedures. So in that waiting area, patient has to wait for around 45 to 60 minutes. Once the waiting period is done, we take the patient for scanning. The scan machine is looks like just like CT scan machine. So it is nothing new. It is like a normal machine which is open from both sides. So no need to worry about that. Patient has to lie down for around 15 to 20 minutes on the machine when the scan will be going on. And once it is done, we will check, our team will check if the scan was properly done. Also, the patient is advised to drink a lot of fluid for the next 1 day at least, so that whatever medicine was injected, it goes out through urine. During the scan, one more injection is done, which is called a contrast injection. So this contrast injection need not be done in all the patients, but once we see that creatinine levels are within normal limit, patient can be taken for a contrast scan. So once the patient is on the machine, we inject this contrast. Some patients, a very few patients might have allergy to this contrast, which is a very rare condition. But if anything like that, we have our team prepared for it. We have all the medicines we need to be given at the time of allergy. So it is all taken care of by our team. Now the other part of diagnostic nuclear medicine includes gamma camera imaging. This gamma camera imaging, depending upon the organ being evaluated, we have different types of diagnostic gamma camera imaging, which includes thyroid imaging, where we can diagnose a certain thyroid conditions like hyperthyroidism, like Graves' disease. Even multinodular goiters can be detected on this thyroid scanning. Other than this, we have renal imaging, where we can assess each function of each and every kidney, and other conditions like any obstruction in the drainage pattern or any poorly functioning kidneys. So apart from this renal functioning, we have cardiac imaging, where we assess the blood flow to the heart. We also have bone scan imaging. So this bone scan during this bone scan imaging, we can diagnose certain fractures, certain infections, and also if a cancer has spread to other bones or not. In this gamma camera imaging, procedure is very simple. We again inject a radioactive medicine into the veins of the patient, which is a very minimal dose of radiation. So once the patient is injected, further procedure is done according to the organ being evaluated. We here at Sri Shankara Cancer Hospital have facilities for treating thyroid cancer, neuroendocrine cancers, prostate cancers, and also certain thyroid conditions like hyperthyroidism, like overactive thyroid disorders. For thyroid related disorders or thyroid cancers, the common radiotracer used is radioiodine. So this radioiodine can be used in treating differentiated thyroid cancer like papillary thyroid cancer or follicular thyroid cancers. Also, it can be given in a low dose for treating conditions like hyperthyroidism. This radioiodine treatment can be given in two types, that is low dose iodine therapy or it can be a high dose iodine therapy. This low dose iodine therapy is mainly used for hyperthyroidism. So in these cases, patient need not be getting admitted. It is an OPD based procedure. So patient comes to our department. Before the patient comes for treatment, patient is already evaluated, like thyroid function tests are done, a thyroid scan is done, and other blood tests are done. And after the patient is prepared, patient will be called on the day of therapy. So once the patient comes for therapy, vitals are checked if the patient is stable, BP, pulse, everything is normal or not. And then once it is done, patient can be administered radioiodine. So this radioiodine is an oral medicine. So either it can be in a form of capsule or it can be in the form of liquid form where it has to be swallowed by the patient. Once the patient swallows this medicine, in a low dose therapy, patient need not get admitted. They can go after around half an hour or 1 hour of the treatment, they can go back home. But also, because it is a radiation medicine, we ask the patient to have a few precautions even at home, like maintaining distance with the general public, maintaining distance with child of less than 5 years of age or any pregnant women. These are few precautions which the patient has to take. So once the patient is appointed for thyroid cancer therapy like radioiodine therapy, patient has to get admitted. Patient comes to our department, all the vitals, everything is checked. Patient gets admitted. Once the patient is admitted, patient is then administered with radioiodine, which is a high dose radioiodine, and hence the patient has to be admitted. The form of radioiodine is same. It is either a capsule or a liquid form. So patient has to just swallow the medicine. Once the patient swallows the medicine, patient goes back to the ward and they have to stay in the ward until the radiation exposure from them is within the prescribed limits. When the patient is within the radiation exposure limits, patient can be discharged from our department. During the discharge, patient is given an instruction sheet with important radiation safety precautions which the patient has to follow after any radioiodine therapy. So the patient has to go back home, but also maintain distance, flush the toilet twice, or drink a lot of water. So these are few things. We have many more things which the patient receives in a written form on the discharge summary, which the patient has to follow. And on the same day, we ask the patient to follow up, which is depending upon the patient's condition. We ask the patient to follow up with us. So this was about radioiodine therapy. We have few other facilities available at Shankara Cancer Hospital. We have lutetium therapies, that is lutetium PSMA therapy and lutetium dotatate therapy. So these lutetium PSMA therapy is given in prostate cancer patients, whereas lutetium dotatate therapy, also known as lutetium PRRT, this is given in neuroendocrine cancers. Now these therapies are an OPD based procedure, so patient need not be admitted for this. Patient can come in the morning, we can inject the patient with the medicine and patient can go home by evening. So it is an OPD based procedure. Therapeutic nuclear medicine has certain advantages, like it is a highly targeted nuclear medicine therapy, and it is minimally invasive, so no need to worry. A very minimal dose of radiation is used. Patients can have improved symptoms and it can also improve quality of life. In few patients, it has also been seen to increase the overall survival of the patient. To conclude, we can say that nuclear medicine is a highly effective and highly specialized branch of medicine that combines advanced imaging to improve patient care.